So let's talk about diagnosing idiopathic condylar resorption, because there is a little confusion about it still. So there's a couple of ways to do it. You can have a CT, cone beam, or you can have an MRI. One of the reasons why I like an MRI is because you can also diagnose disc or soft tissue issues with MRI, but technically to diagnose condylar resorption, idiopathic condylar resorption of the TMJ or condylar that's on the mandible, you can do that off of a CT scan as well. Now, a lot of times I will use an MRI because some patients don't have a condylar resorption, but they have TMJ issues, and one of the things that they may have is a disc problem. It's very common to have a disc issue, for example, anteriorly or front displaced disc without reduction or with reduction. If it's without reduction, that's when you have limited opening and you kind of feel that pressure build up in your TMJ joint. If it's with reduction, that just means there's a pop and clicking. So when you open and close, the disc is sliding back and forth above the condyle, and you can actually see that on an MRI. So usually if I order an MRI, I will order it in an open and in a closed position. And you have to go to like an imaging center to get an MRI. Or if you just want to get your idiopathic condylar resorption ruled out or diagnosed, you can actually do that off of a CT scan. And I usually recommend to have a radiologist to read the CT scan and create a report for you. In the US, and I'm not sure if you can use it from outside the US either, but Beam Readers is a company that employs radiologists and dental radiologists, and they will give you a very professional report if you send them the CT scan, or you can send them an MRI, or you can send them x-rays. But what I would do is I would take either a CT scan or an MRI, and I would get a report from Beam Readers or some kind of board certified radiologist who will read that report. I wouldn't just really trust just one surgeon kind of read your report. I think I would get multiple opinions, and I would get kind of like a certified radiologist to read the report, to read the image, which is a CT scan or an MRI, and give you a professional report that has their name on it. And it's not one of those things like, well, I think this and I think that, you know, word just doesn't mean a whole lot sometimes. I want it in writing. And if you use Beam Readers, they are going to put it in writing. It's going to be an official report of their findings, what they see on the image, or what the problems might be. If it's an MRI, they can give you input about the hard tissue, which is the condylar resorption, and they can also give you an input on the soft tissue, which if there's any disc issues, which is one of the reasons I like MRIs. Now, MRIs are a lot more complicated to get because you have to go to an imaging center. CTs are very quick and easy and tend to be less expensive because a lot of doctors have it in their offices. So that's the difference, and that's how you diagnose condylar resorption as well as TMJ problems and disc issues. Have a good day. Bye.